Hi, my name is Jamie Hall, and today I'm going to discuss medication errors, which is taught in Nurse 330, Law and Ethics for Healthcare Professionals. This video is an assignment for my Master's of Science in Nursing degree program at the University of Mount Olive, and I have 3 objectives and goals. Define the 5 basic rights of medication administration. Discuss the effect of medication errors in the healthcare setting, and describe the most common types of medication errors.
Hi, I am Barbara Walters, and this is 2020. Tonight we're going to talk about medication errors and how they affected one celebrity's life. Good evening, Jamie. Jamie is a registered nurse. She is a legal consultant for cases involving medical errors. Jamie, tell me about medication errors and why they're so important.
So a medication error is preventable. It is either the inappropriate use of a medication that causes harm to a patient, and it can cause birth defects, disabilities, death, and hospitalization.
About how many of these errors occur every year in the U.S.?
Well, according to the FDA, about 100,000 medication errors are reported each year, and a substantial proportion of those are involving hospitalized children.
Who is administering these medications?
So nurses bear the primary responsibility to administer medications. So they are the ones that will take the doctor's order and will administer the medications. There's other medication errors that can involve physicians writing the wrong thing, but ultimately we give the medications.
So tell me about some medication errors.
So a medication error could be missing a medication, giving it to a patient, giving too much of a medication, giving too little of a medication, giving it into the wrong area. So if it's a medication that is an IV medication, you wouldn't want to give it anywhere else. So even a liquid medication by mouth, you wouldn't want to give it to someone through their IV. Also, inappropriate times of giving the medication, missing a medication time. So let's say you forgot to give it to them at a certain time, that would be a medication error.
Why do you think these are occurring?
So a lot of nurses have said in past research that they're just distracted and they're overwhelmed with the amount of responsibilities that they do have. A lot of times nurses will get calls while trying to pull meds, or even in the middle of giving a patient medication. A patient may need something. And so with all those distractions, it makes it very difficult to keep your focus on the medication, even though it can affect a patient's safety.
I hear about the 5 rights. Can you tell us what the 5 rights are?
So the 5 rights is taught in a nursing curriculum when you're in nursing school. And those are the right patient, the right drug, the right dose, the right route, and the right time.
Okay. Dennis Quaid's babies had some medication errors, and you were the legal consultant for that case, correct?
Yes.
Can you tell us what happened?
So in 2007, Dennis Quaid and his wife, they had twins, and on their 10th day of life, they were found to have an infection that needed IV antibiotics. So both of the babies needed PICC lines and needed to be hospitalized. And one of the things that we do to keep the PICC lines from clotting is administering heparin flushes. The nurse that went in to administer this heparin flush ended up administering 1,000 times more the dose than it should have. And not only did it occur once, but it occurred twice later on that evening. So this the babies ended up bleeding from any place where they had any kind of broken skin. And it took 41 hours after giving the antidote to the heparin before the baby's coagulation levels returned to normal. So this could have had a catastrophic event, could have taken these babies' lives.
So how could this have been prevented?
So remembering the 5 rights is really important, and it's not just that. We also have other processes in place that involve our electronic systems at the hospitals that will flag us and stuff. But at the end of the day, if as if we put all our trust in a computer system like that, it's going to fail sometimes. And that's the reason why you need to always make sure that you have the right patient. So when you go in, don't just check their name on their band. If they're able to speak, ask them what their name is, ask them the birthday. Double check the order. Make sure that you've got the right medication label. As with the Quaid case, the heparin label was very similar to the higher dosage of heparin. So make sure that the units matched up would have prevented that. Also, make sure that if you might not know a route something that's supposed to be given in, look it up. I mean, nurses aren't expected to remember everything. So if we follow those 5 rights, right patient, right drug, right dose, right time, then you can prevent. Thank you for your time and attention today. In this brief lecture, we defined the 5 basic rights of medication administration, discussed the effect medication errors have on the healthcare setting, and described the most common types of medication errors. Again, thank you for your time and attention on the topic of medication errors. And don't forget to fill out the short survey and email to Dr. Joy Kiefer at jkiefer@umo.edu. Thank you.